crick in your knees, that first gray hair, that lack of hair, that unexplainable insomnia? What if you can't find your keys in the morning? Is it just the cruel signs of aging, or is it something more serious than that? Dr. Stephanie Beam runs the Executive Med Club of Tampa. Hey, how you doing?
Hey, I'm doing great.
Happy New Year. Haven't seen you in a while.
Thank you.
All right, so is aging a disease that we can treat, or is it just the process and we got to get used to it? Both?
That's the great debate. There are some that look at this, it's going to happen, it's nothing we should do about it, let's just treat the outcome, the degenerative changes. Then on the other hand, there's a whole science and a whole practice like what I do,
right,
which I look at, there's something we can be proactive and prevent and delay some of the onset of diabetes, arthritis, the not feeling well.
Yeah. Let me ask you then, those are some serious things you're talking about, and what are the signs you need to worry about? What are the serious things to worry about, and what's just the stuff that, the forgetfulness and that sort of thing? I mean, there's a difference in forgetfulness and Alzheimer's.
Right.
Yes?
Absolutely. There's three things here. That crick in the knees that you'd mentioned. There's that aches and pains. We can predict the next cold front coming in. Those are things that you can get a test for, get an x-ray, and look and see, is it cartilage loss? Is it just something exercise can do? Is it supplements? Then there's the unknown factor that we don't screen for, which is bone thinning. Particularly for men, that's an important thing, because at age 50, even age 40, we start looking at there's something you can do to prevent bone loss, vitamin D, calcium, even exercising. We don't want to wait for the broken bone to happen, and then it's too late.
Dr. Beam, I'm going to stop you there because we've got a graphic up and we're talking about thinning bones right now. When I think of osteoporosis and thinning bones, I think of women. I really have not thought that much about men having to deal with this, but they do.
They do, and it's because we have not, in terms of the preventative task force, come up with a conclusive age that men should be screened for it. So it's when you don't have that consistency, then you tend to not have it in the mainstream in doctor's office to teach our patients.
Yeah. So, and is it as, I mean, I know it's treatable in women, treatable in men as well?
Absolutely, and it's something that men should get screened for and know if they're at risk, but more importantly, it's a simple test, a bone density machine that can tell you where you stand. Okay,
let me ask you about this. At some point, the desire, the sexual desire, not what it used to be, what do you do?
Well, sometimes we take that for granted, but sexual health is just as important in your well-being as physical health. So you look at, is there medications you're taking? Blood pressure medicines are a big culprit. Antidepressants, too much alcohol, too much stress, maybe the relationship. Find out what is that root cause, and it can make a big difference.
We got to go. We got to leave it there. It's good to see you.
Good to see you.
Love having you here.
Thank you.
Always bring something new to the table. We appreciate it.
Love what you do.
Thank you. You too. Dr. Stephanie Beam, an age management specialist with the Executive Med Club of Tampa Bay, and we have a link and all this information and Dr. Beam's contact information under the Scene on TV section of myfoxtampabay.com.